Namaste Vidya, Hamisha Khush Raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture, we are going to start with the thermal injuries. There are two types of thermal injuries, heat injuries and the cold injuries. In today's lecture, we are going to discuss about hypothermia or the cold injuries. Now, what is the mechanism of thermoregulation? The body temperature is controlled in the hypothalamus, which is directly sensitive to changes in the core temperature and indirectly responds to the temperature sensitive neurons in the skin. The normal set point of the core temperature is tightly regulated within the range of 37 plus minus 0.5 degrees Celsius, which is necessary to preserve the normal functions of many enzymes and the other metabolic processes. In the cold environment, the protective mechanism includes cutaneous vasoconstriction and shivering. However, any muscle activity that involves in any muscle activity that involves the movement may promote heat loss by increasing connective loss from the skin and respiratory heat loss by stimulating ventilation. In the hot environment, sweating is the main mechanism for increasing heat loss. This usually occurs when ambient temperature rises above 32.5 degrees Celsius or during exercise. Hypothermia. Hypothermia exists when the body's normal temperature thermal regulatory mechanisms are unable to maintain heat in a cold environment and the core temperature falls below 35 degrees Celsius. Hypothermia also occurs in healthy individuals whose thermoregulatory mechanisms are intact but sufficient to cope with the intensity of thermal stress. The etiology of hypothermia. Infants are susceptible to hypothermia because of the poor thermoregulation and high body surface area to weight ratio. Hypothyroidism is often a contributory factor in the old age. Alcohol and other drugs commonly impede the thermoregulatory response in the younger people. Secondary to hypothyroidism, glucocorticoid insufficiency, stroke, hepatic failure, or hypoglycemia. Hypothermia also occurs in healthy individuals whose thermoregulatory mechanisms are intact but insufficient to cope with the intensity of the thermal stress. These are two types. The different three types are the acute hypothermia. It occurs when the individual is immersed in the cold water and the core temperature falls rapidly. Subacute hypothermia. It occurs on the exposure to the extreme climate, such as during hill walking and slow onset hypothermia. Subchronic hypothermia is develops in an immobilized older individuals. Infants are susceptible to hypothermia because of the poor thermoregulation and high body surface area to the weight ratio. Hypothyroidism is often contributory factor in the old age. Alcohol and other drugs commonly impede the thermoregulatory response in young people. It can also occur secondary to hypothyroidism, glucocorticoid insufficiency, stroke, hepatic failure, or hypoglycemia. Now the clinical features of hypothermia. Depending on the body core temperature, it can be classified into mild hypothermia, moderate hypothermia, and severe hypothermia. If the temperature of the core is between 35 to 32 degrees Celsius, then it is mild hypothermia. If the core temperature ranges between 28 to 32 degrees Celsius, it is moderate hypothermia. And if the core temperature is between 23 to 28 degrees Celsius, it is severe hypothermia. And below 23, the patient can go into coma with dilated unreactive pupils and cardiac standstill. So the clinical features of mild hypothermia consist of cold and shivering, mumble, stumble and tumble. There is lethargy, dehydration, tachypnea. The symptoms of moderate hypothermia are the violent shivering, slurring speech, slow labored movements, ataxia, mild confusion, and pallid with blue lips. The clinical features of severe hypothermia are the cold and not shivering, cold pale skin, depressed consciousness, muscle stiffness, bradycardia, and hypotension. Now, what are the investigations that are needed to be done in case of hypothermia? Blood gas analysis, a full blood count, electrolytes, chest X-ray, and electrocardiogram, that is ECG, are all essential investigations. Hemoconcentration and metabolic acidosis are common, and the ECG may show characteristic J waves, which occur at the junction of the QRS complex and the ST segment. Cardiac arrhythmias, including ventricular fibrillation, may also occur. The arterial partial pressure of oxygen in the blood falls to about 7% for each 1 degree fall in the core temperature. Serum aspartate aminotransferase and creatinine kinase may also be elevated, secondary to the muscle damage. Serum amylase is often high due to the subclinical pancreatitis. Additional investigations for thyroid and pituitary adrenal dysfunction, hypoglycemia, and the possibility of drug intoxication should be performed. In the management of hypothermia, the objective of management are to rewarm the patient in the controlled manner while treating associated hypoxia, fluid and electrolyte disturbances, and cardiovascular abnormalities, particularly arrhythmias. Mild hypothermia due to continued heat loss is prevented by sheltering the patient from the cold, replacing wet clothing covering the head, and insultating him or her from the ground. Management of severe hypothermia. In the case of severe hypothermia, when body temperature, core temperature goes below 28 degrees Celsius, the patient with cardiopulmonary arrest or non-perfusing rhythm, or those with cardiac instability, systolic blood pressure less than 90 mm of Hg, or ventricular arrhythmias, the aim is to restore perfusion and rapidly rewarming at the rate of greater than 2 degrees Celsius per hour is required. Cold injuries, there are different kinds of cold injuries. One is the freezing cold injury, that is the frost bite. Direct freezing of the body tissues and usually affect the extremities like the fingers, toes, ears, and face. The risk factors include smoking, peripheral vascular disease, dehydration, and alcohol consumption. Frostbitten tissue is initially pale and duffy to the touch and insensitive to pain once frozen. The tissue is hard. The management consists of oxygen and aspirin 300 mg. Frostbitten extremities should be rewarmed in the warm water at 37 to 39 degrees Celsius with antiseptic added and providing adequate analgesia. Cold injuries. The third variety is non-freezing cold injury that can cause wrench or the immersion foot. Prolonged exposure to cold, damp conditions can cause trench or immersion foot. The limb, usually the foot, appears cold. There is ischemic and numb, but there is no freezing of the tissue. On rewarming, the limb appears mottled and thereafter becomes hyperemic, swollen, and painful. The recovery may take many months, during which the period there may be chronic pain and sensitivity to the cold. Next is the chilblains. The chilblains are tender, red or purplish skin lesions that occur in the cold and wet. They are often seen in horse riders, cyclists, and swimmers, and are more common in women than in men. They are short-lived and although painful, they are not usually serious. So this was all about hypothermia or cold injuries. In the next lecture, we will be discussing about the heat injuries. This session was powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.